Good afternoon, everyone. I'm excited to present our study, Financial Incentives Moving the Needle on Follow-Up Rates. So studies have shown that consistent follow-up visits improve weight loss after bariatric surgery. However, weight loss in a number of studies have shown to be as high as 56% for loss. In order to help our patients achieve their weight loss and their comorbidity resolution goals, we examined whether financial incentives could be one way to increase their follow-up rates. So this is the structure of our financial incentives program. So participants at 3 of the collaborative sites, this was done through the Michigan Bariatric Surgery Collaborative, participated in this program. And participants receive financial incentives for completing one or both of 2 goals. The first goal being attending their postoperative visits. And the second, if they did attend the visit, then if they weighed less than the previous visit, they also received a second incentive. So for example, at their first month follow-up visit, they could receive $10 for attending, and then another 10 if they had a weight that was less than their preoperative weight. And throughout the program, a patient can then receive $140 in total if they met all of the goals. Each patient enrolled in the program underwent 6 months of participation in the financial incentives program, and we used a difference in differences analysis to see if the financial incentives program did significantly affect follow-up rates. This is the structure of the program and for our analysis. So I'm not sure if we're able to see my pointer here. Yes. So here are the 110 participants in the financial incentives program. They were matched in a 3-to-1 fashion with patients from other control sites that did not undergo the program at the same time. We then attempted to match in a 1-to-1 fashion with historic patients. So in the orange are historic patients that were matched from the control sites. And then patients who participated in the financial incentives program were also matched 3-to-1, or we attempted 3-to-1 matching with the same program sites, but with patients who had not been involved in the financial incentives program. So these are the 4 groups from which we were able to then perform our difference in differences analysis. And the 2 outcomes that we looked at were changes in rates and follow-up, as well as their excess weight loss afterwards. This is to show that we had balance between all 4 groups in terms of our matching. Not displayed here is the mean pre-op BMI, which was 47.3 for all groups except for the pre-intervention program sites, which was 47.5, but this was not statistically significant in terms of the difference. And overall, you can see from the demographics, so from age, the gender, race, and procedure type, that we were pretty evenly matched between sites and also between pre- and post-intervention periods. Not displayed also is insurance, which was not statistically significant between pre- and post-program sites within groups, except for Medicaid patients. So in the pre-intervention period at sites that had undergone the incentives program, they had significantly more Medicaid patients at 12.3% compared to 7.3%. So I'll start by walking through how we set up our difference in differences analysis. So here, in orange, again, we have our control sites. So this represents the time period in which the intervention took place. So here are the 110 patients who underwent the financial incentives program. They were matched with their historic controls at the same sites. Here are the control sites, contemporary patients at the same time as the financial incentives program was going on, but these patients did not undergo the program. And again, their historic sites. So in our difference in differences analysis, if there had been no difference, because of the intervention, we would have seen that follow-up rates would have had a parallel trend to what was happening at our control sites, which is represented by this dotted line here. But instead, we found that there was a significantly different follow-up rate after the implementation of this incentives program. For the first difference, we look at the pre and the post follow-up rates, and then we compare the difference between this point and this point, and this point and this point, and that gives us our final absolute difference in differences. So we can see for our 1-month follow-up rates that we did have a statistically significant difference due to this intervention. At 3 months, this continued, and at 6 months, this continued. The program ended after 6 months, and so we measured the follow-up rates again at 1 year to see if the program had any residual effect afterwards. And we found that that did not happen, that the effects at 12 months were lost, and here you can see that our p-value is 0.07. We also looked at excess weight loss in the same time period, and we found that even though we had significantly different follow-up rates, that the excess weight loss was not statistically significantly different between the two groups. We also looked at 2 moderators for potential effects on this financial incentives program. So the first being race. We looked at white versus non-white race, and we found that although there was a moderating effect in the first month, that this was then lost in the months that followed. We also looked at income, separating patients who had a yearly income of less than $25,000 and those who had greater than that. And those models showed that, again, there was some moderating effect at the very beginning, but that this was lost later on. So in summary, we found that the financial incentives program did significantly increase rates of follow-up while patients were actively participating in the program, but that the effect was lost after the program had ended. And we found that the financial incentives program did not affect the excess weight loss. More research is needed to determine how we can translate these increased follow-up rates to also then greater weight loss postoperatively. And a next step could also be to determine if actually the effect on weight loss will need to be seen later on, that maybe at 1 year the trajectories were the same, but really the effect could be in the years that follow. I want to thank my collaborators on this project, especially Dr. Gaffari for his mentorship during this time. Also wanted to thank the Michigan Bariatric Surgery Collaborative for allowing me to do research with them for the past 2 years, as well as the Veterans Affairs and the National Clinician Scholars Program. Happy to take any questions.